Well, good afternoon and welcome to GPA Live. I'm your host, Ron Aaron Eisenberg, and delighted to have you on board. GPA Live is a production brought to you by the Global Pain Association, and we'll talk more about that in just a moment. We are a virtual education series, and we bring you all kinds of fascinating topics, primarily designed to help folks who are dealing with chronic pain. Today's topic is AYAs, cancer, and pain. And we'll explain all that in just a couple of moments. Our special guests are with a fairly new nonprofit, the AYA Foundation. Christina Johnson is a cancer survivor, and Dr. Jaime Estrada is founder and board chair of the organization. Now, before we introduce them, let's take a moment and talk with the founder and president of the Global Pain Association, Dr. Susan Blackwood. And we're delighted to have you on board, Susan. Good to see you.
It's a great Saturday. Weather's beautiful. And what could be better than to have another Global Pain Live broadcast? And thank you for being our moderator. Thank you so much for the Eisenberg Group for putting this on, and to all of our sponsors and people that have made this possible. Global Pain Association started in 2017. I can hardly believe that we're going on our 4th year as an organization, but it's to help people with chronic pain and their caregivers find alternative ways to manage their pain. And now we're reaching, because of our virtual series, over 70,000 people, and couldn't be happier about the organization and the direction that we've taken.
Now tell us a little bit about the new support group as well, GPA Warriors.
That is an amazing group of people that get together the first and third Tuesdays of each month at 7 p.m., thanks to Connectability that has put this all together for us, to talk about how, as a resource, not only can Global Pain Association help, but how they can help each other. And we've got an amazing moderator, Dr. Marianne Pinkston, who's done an incredible job of reaching out to people and helping them as they're willing to talk on the support group page.
Now we're going to talk with you in just a little while after our presentation, talk about how folks can get involved in the Global Pain Association, talk about how they can be volunteers, how perhaps they have some questions, suggestions for guests for GPA Live, and how, more importantly, they can donate and support the organization. So Susan, stand by. We'll pick you up in just a few minutes. Now, I want to share with you some information about our special guest today. Let me first introduce Christina Johnson. Christina is a cancer survivor of stage 2 colorectal cancer. She was only 32 years old when she became ill. Doctors in Austin thought she had a gluten allergy, lactose intolerance, Crohn's disease, and who knows what else. It took them 5+ months to figure out what was wrong with her. And after a CT scan, they discovered a large mass in her lower colon. She survived radiation, chemotherapy, incredible extreme pain, and she lost her choice and opportunity to have children. As a cancer survivor, Christina will tell us about cancer, that it doesn't discriminate, and it's important to know your body and to be your own advocate. Our other guest is Dr. Jaime Estrada, founder and board chair of the AYA Foundation in San Antonio. He has had a distinguished medical career, 35 years in pediatric hematology and oncology, chair of the American Cancer Society HPV Vaccination Task Force, founder, president, and now executive director of Texas Doctors for Social Responsibility. I'm going to thank both of you for joining us today on GPA Live. And let's kick it off with Jaime. Dr. Estrada, for those who don't know, what is AYA?
Well, first of all, thank you so much for the invitation and for the opportunity to Ron, Gina, and to Dr. Susan Blackwood. We are privileged to participate in this broadcast. So AYA is short for adolescent and young adults. And as you may know, we're talking about young people between 15 and 39 years of age who are going through the diagnosis, treatment, and survival of cancer. So there is about 75,000 of these young people that are diagnosed with cancer in any year in the United States. and they have not just medical, but also psychosocial issues, and hopefully well, I know we'll be talking about these issues.
Right, and the importance about the
I'm sorry, Ron.
The importance about the foundation is the help and support you give to people like Christina who are struggling with both diagnostic, treatment, and post-cancer.
Yes, our mission is to support AYAs, both from the psychosocial standpoint and also financially with help for fertility preservation procedures.
Now, let me just take a moment and welcome those who are in our chat room. If you're watching us on the GPA Live Facebook page, please take a minute and share this program so that others can benefit from it. Share it widely, and we hope to encourage people struggling with chronic pain, or if you know someone who has chronic pain, you can let them know about this program. Thank you to those who are already posting, and we look forward in just a moment to seeing if you have any questions in our chat box. Let me turn to Christina. Thank you so much, Christina. I know what you went through had to be terrible. Talk to us about that journey when you were diagnosed with cancer and what led up to the diagnosis.
Well, thanks for having me. Like you said before, I was diagnosed at 32, November 28th, 2018. It all came about, I was living in Jackson, Mississippi, and I was getting ready for a big move to Austin. I'd say probably 2 weeks prior to my move, I started experiencing diarrhea. Who hasn't, right? It happens. So I didn't really think much of it at first. And then as the move got a little closer, and, you know, I played it off to stress, you know, maybe it's stress, maybe I'm just stressed about the move, you know, I'm going through a big change. And ultimately not having health insurance kind of made me just kind of think it's going to go away, or, you know, maybe it was something I ate. And then it was after moving to Austin, trying to navigate a new city, I heard about the medical access program, which would allow me to see a doctor on a sliding scale. And so I saw a doctor. We did tons of stool samples, tons of blood work. Everything kept coming back normal. Blood started appearing in my stool. So, you know, I'm freaking out. Doctors don't have answers for me. And, yeah, it took 5 months for a CT scan to be ordered. And then it took another month for that CT scan to be approved. So 6 months total of having these symptoms where I was going to the bathroom 15 times a day. I was living in the bathroom. I had lost tons of weight. I was super, lethargic all the time and just didn't have any energy. But the CT scan came back, and that's when we discovered that I had a mass in my rectum, and it needed to be addressed immediately. So I didn't have a chance to preserve my eggs or think about fertility. Didn't really have those options. And so I started radiation and chemo pills immediately. And the point of the radiation was to try to shrink the tumor so that when I had surgery, it wouldn't interrupt my muscles that would allow me to control bowel movements. My surgeon told me going into surgery that I may have to have a colostomy bag, and it would either be temporary or permanent. Luckily, it was neither. I had a great surgeon and didn't end up having to have one. But radiation, it was very intense. It was very painful. I started to have, blisters on my bottom. I couldn't sit. And I was put on fentanyl. I was a little apprehensive to take it, as addiction runs in my family. But the pain was too much. And, my doctor explained to me that that's why these medicines were created, for cancer patients and people with chronic pain. So I took fentanyl for a while. Yeah. And then I had, after radiation, it was 4 weeks of healing. And then came surgery, where they removed 8 inches of my colon, my tumor, my ovaries, and my tubes. So with radiation, my ovaries were fried. And with females, colorectal cancer likes to come back and hide itself in the ovaries. And since mine were no longer functioning, my doctors thought it would be best to just go ahead and remove them. Yeah, so we did the surgery, and then 4 weeks after, giving my body a rest, I started a more intense round of chemo, and that was to better my odds of it not coming back.
Now, during all this time, Christina, you'd moved to a city where you knew nobody. You'd had a job, but you couldn't keep working because of the pain and then of the surgical procedure. How was it you came across AYA and Dr. Estrada?
I was on a mission to try to find a support group. While I was doing my treatments, I didn't see anyone that was my age. They told me I could go to a support group for colorectal cancer with 5 older gentlemen, and I just didn't think that would be a good fit for me. So on a mission to kind of find my own support, I reached out to the American Cancer Society, and they put me in touch with Dr. Jaime. And it's been amazing to, be introduced to young people that have also, shared a journey similar to mine. And then also be given this platform where I can find purpose in my journey through sharing and bringing awareness to others. So
now is the pain gone now that you've been through all that treatment? Are you pain free?
I am pain free. I had a clear CT scan last month, so I won't have to be tested again until next year. So yeah, life is, you kind of want to rush through the treatment and just kind of get things back to normal. And, you slowly realize that you're going to have a new normal. Because my ovaries and my tubes were taken, it threw me into menopause, which has not been all that fun. So yeah,
are you able to do hormone therapy with menopause?
Unfortunately, I am not. So, once diagnosed with colorectal cancer, I did a genetics test, and the test came back and said that I have a mutation. It's called the PALB2 mutation. There's no record of anyone else having colorectal cancer that also shares this mutation. The mutation is known actually for breast cancer. So I get tested for breast cancer every 6 months, kind of alternating between mammograms and MRIs. And I am unable to take any estrogen or hormone replacement for the fear of it, igniting or setting, gas to the fire of breast cancer. But I have a doctor's appointment coming up to kind of discuss my options and see whether removing my breast is going to be, if the odds are going to lower enough that it would be beneficial. And also with removing my breast, I would be allowed to take estrogen and perhaps feel like a young lady again. So, it's a struggle, and, cancer never leaves. Once you have cancer, you always fear that it's going to come back. And, so I'll have to make some big decisions here in the future about, what to do in terms of my mutation.
One of our commenters in the chat room says, "What a story, honey. Thank you for sharing. You are one tough lady." Well, I'm sure we all feel that as well. Tell me again about AYA and what it has done for you.
I think most importantly, it just allowed me to talk to young people that every journey is different with cancer. There's no two journeys that are alike, but just knowing that I wasn't the only young person that had gone through this, it flipped my life upside down. I never expected, colorectal cancer. We all have these stereotypes. To me, that was the old man's cancer. I never in a million years thought that would be my diagnosis. So AYA has been great just to, be introduced to other young people. And also, being given this platform to share my story, it's been healing for me. So yeah, I'm very grateful for AYA.
Let's turn to Dr. Estrada for just a moment. Jaime, it must make your heart go pow, pow, pow when you hear her talk about how AYA has been so helpful.
Oh, yes. The story of Christina is been remarkable, and one of the points that it brings up is that a particular type of cancer is actually being diagnosed more frequently in young adults, colorectal cancer. So it's not a disease of older people any longer. So that's a huge thing that people need to know, and young people need to know. There are many issues in her story that are remarkable. One of those is also that these people don't have, these young people don't have a support group. It's difficult for them to find people of their age to talk to. And so one of the priorities in our group, in our organization, was to develop a support group, which is made of people like her who have gone through similar journeys, and so who can bring to other young people who are just diagnosed or who are going through treatment or who are dealing with the adverse effects of the treatment or the cancer after therapy, just somebody to talk to. And so our support group is doing that, and we're very happy about it. That Christina is one of the founders of that support group. So psychosocial issues are very important in this group of patients. It's not just the medical issues, and so these are young people who have who are starting school, are starting careers, are starting families, and becoming independent. So when they are diagnosed with cancer, their worlds just turn upside down, and then become dependent, and they become isolated. And body changes are very important, like losing their hair and so on. So they need a lot of psychosocial support. Most of the attention has been given over the years to children with cancer and older people with cancer, but people don't realize, and they need to know, that young adults with cancer, or AYAs, are actually fairly common, 5 times more common than kids with cancer, the little ones with cancer.
Now, talk to me a little bit about the challenge that cancer patients like Christina have when it comes to sterility. She really didn't have time to have the procedure to remove eggs and have them frozen. But AYA has been very supportive in this field of trying to preserve the ability to have children. Tell us about that, Dr. Estrada.
And you're right. That's a huge issue on young adults with cancer, because either the cancer or its treatment can affect their ability to have kids in the future, can affect their fertility, and so the typical procedures to preserve the fertility in a young woman with cancer are to stimulate their ovaries with medications, then specialists who do these procedures, the eggs are collected and frozen, and so even though it sounds a simple procedure, it's very costly. The drugs to stimulate the ovaries cost around $5,000 to $6,000, And the procedures themselves, you're talking about $10,000, $12,000. So many patients and their family just don't have the means to pay for these procedures. So unfortunately, when I was in practice, I had the opportunity to deal with young women who were candidates for these procedures, but just didn't have the means. So they had to undergo treatment for the cancer, which was, on the long run, more important. But our foundation decided that helping these young people, not just the women, but also the young men with cancer, that helping them financially to make up the cost or to pay for all the cost of these fertility preservations was something that we needed to do as a priority. And so we already had the opportunity to help a young man, a 31-year-old with Hodgkin's lymphoma, who we helped with no insurance to help pay for the cost of freezing the sperm, which is more it's easier than in a young woman with cancer. So we are asking the public to contribute to our mission to help these young people so that we can help them.
Now, you're a 501c3. People can donate and get a tax deduction for that.
Yes, we are 501c3. Our website is going to come up in the screen, I understand.
Yeah, we'll put it up in just a minute.
You can learn about our young people who are part of our support group, about our mission, our goals, and so on.
Let me go back to Christina.
They can donate.
Let me go back to Christina for just a minute, because one of the things that you did while you were looking for ways to address the pain, you joined a yoga class for folks with cancer. Talk to me about that.
I did. I came across, I believe it was survivors of cancer, and I was still in treatment, and it was free of cost, but, I went just looking for support, and I definitely found it. It was a group of older ladies all doing their yoga, and it helped. It helped me center myself and just know that I wasn't alone, So, yeah, for the yoga.
I need to congratulate you on that. And one of the things I'm sure you discovered during yoga is mindfulness, how to deal with breathing and how to center yourself and deal with the present.
Absolutely. Being the whole process of, going from radiation and surgery and you're not present in it. It's all happening so fast, or at least it was for me. And, I think there's still some things that I have yet to fully process emotionally. But yoga is definitely helped, try to stay present in the moment. So, yeah, it's been good.
Well, thanks so much for telling that story. And Dr. Estrada, what haven't we asked you that you'd like to share with those watching us on GPA Live?
I'd like to share with the people and with the public that those with cancer need their help, and that we need to provide them with as much support, not just medical support, but psychosocial support. Fertility preservation is a huge issue, and we are focused on that right now. So we will appreciate people's support to help, so that we can help them. So this is our logo and our website address.
That's www.ayafsa.org. And again, you go to the website, you get all kinds of information about the foundation, and it'll direct you on how you can contribute as well. Dr. Estrada and Christina, thank you so much for joining us today on AYA Live. It's great to hear your story. Well, thank you. And Christina, we're so glad you're doing well. We wish you the very best. And thank you for your work with the AYA Foundation.
Yeah. Thank you for having us. Appreciate
You
it.
take care. Dr. Estrada, thank you.
Thank
Bye-bye.
you.
What a great story, and we hope those of you who've been watching it will share. And again, all of these shows and programs are cataloged on the Foundation's website. So your Global Pain Association on the website, you can find all of these shows. Let's go back to Dr. Susan Blackwood for just a moment. Susan, that was a powerful story.
Amazing story. And there's so many people with a lot of chronic pain issues that we have been trying to reach and address. And folks can help us with our plan going forward, our strategic plan, because our board will be meeting again in May to come up with some ideas of how we can have more outreach and have more success in being a resource for people in the community with chronic pain. And I urge everybody to go onto our support group on Monday, on the 1st and 3rd Tuesdays each month at 7 p.m. Join Dr. Pinkston and her group and talk about some of the issues that you have experienced, or others that have experienced, so that we can have a network of people that can support each other.
And for those who want to get involved as volunteers or have suggestions on what they'd like to hear on GPA Live, the website email address is on the screen. What about donations, Dr. Blackwood? How do they help the organization?
Well, certainly we can only have these virtual series and other events in person if we have sponsors, donors, vendors that have supported the doctors that are dealing with patients with chronic pain. And so we urge them to go to our website. No contribution is too small. All of it will help. Our website, globalpain.org/donate, will get them to a page where they can make a contribution. And every bit helps. It's a tax-deductible contribution because we're a 501c3 and have really enjoyed the support that we've gotten in the past, but we always need more.
Well, thank you so much. And we'll see you again next Saturday for GPA Live. In fact, coming up next Saturday, May 1st at noon, right here on GPA Live, our topic is ways to help pain and stiffness in arthritis. And Dr. Pendleton Wickersham will join us. Dr. Wickersham has been on before. He is an incredible guest, also on the board of the Global Pain Association. So join us next Saturday, May 1st, with Dr. Penn Wickersham, ways to help pain and stiffness in arthritis. And if you have questions you'd like answered, just email info@globalpain.org. On behalf of the board of the Global Pain Association and on behalf of Gina Galaviz Eisenberg, who is my wife and the executive producer of this program, thank you very much. By the way, if you'd like to receive the newsletter for the Global Pain Association, go to globalpain.org and you can sign up. Thanks for joining us, and we'll see you next week on GPA Live. Take care, everybody.